In the heart of Ghana, where vibrant cultures meet boundless potential, a quiet revolution is transforming healthcare. 6 hospitals spread across 3 regions of Ghana have redefined what it means to care, not just for the body, but for the soul of a nation. It is a unified mission to provide quality, affordable healthcare to all. From outpatient consultations to life-saving surgeries, every service is free for NHIS active clients. Here, an expired NHIS card isn't a dead end. It is the beginning of a journey. No NHIS card at all? No problem. These hospitals do more than treat. They renew hope by registering patients on the National Health Insurance Scheme right at their premises. It is healthcare that meets you where you are, breaking barriers and building bridges to a better life. This is quality healthcare, seamlessly weaving compassion with action. Every renewed card, every new registration, every healed life is a bold step towards fulfilling SDG Goal 3, which seeks quality healthcare and well-being for all, with no exceptions at all. In this 6-facility hospital chain, treatment knows no boundaries. Whether you need a routine checkup or a complex surgery, care is delivered with precision, dignity, and love. It is more than medicine. It is a promise, a revolution, and a future where health is no longer a privilege, but a right. This is not just a story of hospitals. It is one of humanity, healing, and hope. A place where no one is left behind.
Our vision of establishing hospitals, providing quality healthcare, affordable for all, did not just come like that. It was a reason behind it, and the reason was that by the grace of God, I was brought up in a village. I came to Kumasi to further my education, and I came to stay with my elder sister at a place. And this elder sister I love so much, God's grace. Once upon a time she fell sick and she was sent to a hospital. At that time, the hospital we called Council Hospital on Lakeside. And she was operated of the fibroid. So we're happy our sister has been operated and she is okay now. But after a month, the condition reoccurred again. So she was this time around referred to confirmation, and she was to do second operation. And because of the cost involved in the first operation that the family has been incurred, the cost of second operation became very, very serious. And I myself sent a message to my daddy, who was a cocoa farmer at the village called near the BRC village there. And it took my daddy almost 1 week before she was able to raise the amount that were being charged at confirmation. And when my daddy came, the money was available. The situation had become so worsening. We took the sister to the hospital, and the next day the doctors were preparing to do the surgery. My sister gave up the ghost. In fact, it seems to me like the whole world has come to an end. I decided not to go to school anymore because who is to take care of us once our parents are in the village over there. So, in fact, I decided that, okay, I will try my possible best to become a medical doctor in future, so that when any of my family member gets sick, money will not be issue again. So I pray to God, do everything that I could to get a grade that can offer me admission at medical school in Ghana here. And I did my possible best. I couldn't go to do this course. So I said, okay, if I'm not able to do the medicine, I will try as much as possible to do any program that will give me chance to work at the hospital. So I did my possible best, and I got admission at Kumasi Polytechnic to do pharmacy technician program. At that time we call it dispensing technician. And with this, by the grace of God, I got a chance to work at Confirmatory for some time. And from Confirmatory, also by the grace of God, I got the opportunity to work at Matade Hospital as administrator. Over there, I worked for 7 years, and within these 7 years, I did a number of management programs, and that will help me to really do very well in hospital management. And from there, God gave me the opportunity to establish my own hospital. I started as a maternity home at Kumasi called Royal Place Maternity Home in 2015, October 10th. And by the grace of God, through the Royal Place Hospital Maternity Home, today you are here and you are interviewing me at an NHIS hospital in Ghana at the moment. So the only motivation is nothing else but to provide quality health care that is affordable for all.
In the heart of Medina, Accra, there's a place where healthcare takes on a whole new meaning. It is not just a hospital, it is a promise, a sanctuary of hope where barriers crumble and lives are transformed. Welcome to F Alpha and Omega Specialist Hospital, where care is always free for patients with active NHIS cards. And for those without it or with expired cards, new cards and renewals are done to enable them access medical care at no costs. It all begins with general outpatient services, the starting point for expert diagnosis, compassionate consultations, and a roadmap to recovery.
Brother, my bahano. Kwa kumasho ni kama the NHIS na mede bahano mo. Ndo mma me bro anwa chifu mma me bro on e panie eni fuo aye ntu akapo. Doctor baye my complain o ma kwe eye check up ni we check up na ani na NHIS. Na mo ya dia pa mo asi.
Mba ahada. Na tize ni na me bai. Tani mene me na boy na bai. Ono no ko pe ni na so. So bai ni doctor se e ma ni fu ranjere fu. So ba ha no mama ni su ke. Trade no mo ni anu bio. Ke trade ni dia ni to. That seven ni na no. Omo de ma. E wa ha. O bai ni chi esi bio. Na si ti na. Omo si ko ba sa nya na ni. Ni ti na o ma nje ni. Ene kwa nko mu yi ni de dom se duro na mo hwa ambasa ma me ba. Ene kwa no kwa no kwa ma nje sika ama sa ya ma ni. Aye da be se so so no sa na no fu. Ni ba ni chi ski ya ala. Omo juma ye eso yi ni fa. Ana jula ya ya da pra no mo ne na nya na me so. Mo se yeso. Mama bo mo wa de wa ha ni fa.
The nurses and the doctors are very good. They have patients very well. And I really want to appreciate them. One of my friends told me this place is free. When you have NHIS, you'll be given free medicine. What they have, they will give you free medications, drugs that they have, they will give you. And the one that they don't have, they will give list of it to go for you to go and buy it outside. I didn't pay for any drugs because I have NHIS, which covers some of the drugs that I have given to me.
don't know why I see them. They already on the ones they do. Then you want to just be a type. It's a man who will be over. I'm some background. In the time of one thing, I can say, so I mean, I'm a Yarisa. And then I thought of you. And I did my family. And you said, I had a dinner and also breakfast. That is when you have a mother here. I'm not here, I'm here. But you know, I can take you to the house and you know, maybe I'm thinking before work. And she never had it. I said, my fault. There's an hour by which you are saying, this will be a blooming lady in a short. But also, 120. It's not for me or how much they might.
When recovery requires a stay, the inpatient care facilities provide comfort, care, and a place to heal fully.
The theater that the place, the other place where we came from now, we have theater machines, we have patient monitors, we have dietary machines, we have suction and aspiration machines, and all sorts of things that we use for surgery. Here is our second theater. We use it mainly for gynecological operations. In the case that we may need other complex things, we bring them from the other theater and come in help us. So virtually theater, the labs are very important. Any other things we need for neonatal resuscitation. We need to be resuscitated. We must stress that this hospital has, in fact, it has at least the basic things that we need for surgery. We have the basic things that we need for surgery, and they are being well utilized.
The surgical team works miracles daily, performing both general and specialist surgeries with precision and expertise.
This is the recovery and ICU for F Alpha and Omega Specialist Hospital. We have 4 beds available with a ventilator and also oxygen point for our patients. For each bed, we have a specific oxygen point. This is a patient that had surgery, cesarean section 2 days ago, and the recovery. Another patient just had saphenectomy on account of ruptured ectopic pregnancy, and she is also recovering now.
You transfer me free quickly at the buyer. Now, my buyer now a walk. Now, my BP was super. The me buyer so I am operation ni bibiano. Me nam insurance kutamintino. Ya anya me free. Ya ye ni nyina de ma. Anya me ncha de ma me ba ekuta me so me ho odin. Ya hwe me kama. Ntino me pese obia ede na ni kire ha se aha se susuru Nyankopon na ne nkoa ne mfuna ne mdie so adwuma.
In obstetrics and gynecology, every life is nurtured, every mother supported, and every bed celebrated with joy. For the youngest patients, pediatric care is designed with compassion and specialized attention to keep little ones thriving. At the ENT clinic, clarity is restored in treating conditions that affect the essential senses of hearing, breathing, and speech. At the eye clinic, patients see the world anew with solutions for every visual challenge.
Here, what we basically do is we work on family eye care, whereby the patient can assess, talk to the patient, get to know what actually got the patient here, and then within my jurisdiction, I prescribe whatever I'm supposed to prescribe within my capacity as optometrist. Anything beyond my capacity or role, I refer either to the general practitioner or to the ophthalmologist to take it there. Here, basically, we take health insurance. So we don't take any money aside the lenses. And the lenses which is not under the health insurance, that one the patient have to pay. Most of the conditions we normally see here is allergies, dry eye, and then refractive error. And for the aging population, presbyopia, whereby they find it difficult to focus on small print and read. And for those conditions, we manage it here with glasses. Now it's a natural process with aging. And then those who need to see the ophthalmologist, I refer them mostly to 37. Sometimes Crystal Acne, where they have a specialist ophthalmologist there to take it from there and also manage the patients.
Healthy smiles come alive at the dental clinic as everything from routine cleanings to complex dental procedures are expertly taken care of.
And as you can see, I have a patient in the chair right now, which I'm here to do SMP for the patients. When you say SMP, yeah, people don't understand the meaning of SMP. SMP means cleaning. We are here to clean the patient's teeth. She's here to do a normal cleaning, which everybody has to visit the dental at least twice in a year, which is every 6 months. You need to visit the dentist every 6 months for your dental checkup. Painful? No. Dental cleaning is not painful. We just use some vibration and water. And when I say vibration, we have a machine here which is called the scaler machine. That's what we use in cleaning. And we have a suction tube here. What is the suction tube used for? We put it in your mouth to suction out the water, because we are going to use it, basically we are going to use water and vibration, and you can't just swallow the water while we are working on your mouth. So we need to put in the suction machine to suction out the water for you. So as you guys can see, I'm about to start my SMP now. So as I'm putting this in your mouth, you just relax for me. I'm going to work in your mouth, so you breathe through your nose, okay? And any water that comes through your mouth, this machine will suction it out for you. It doesn't matter when you swallow, it's not a poisonous water, it's distilled water, okay? And if anything, while I'm working, just raise up your left hand for me to see, then I'll stop, then you can take me, okay? Close it in.
Currently, this is the maternity unit of FR Alpha and Omega Special Hospital. We do variety of services here, that's antenatal and then postnatal and delivery. So we have the antenatal days to be Thursdays and Tuesdays, and then we are able to handle a total of 50 or more per day. And as we all know, our pregnant women come with variety of problems, but as days go, with the education and understanding their cultural background and education background, we are able to handle the above mentioned problems. So with the pregnant women, some come with anemia just because they are not able to feed well because of the pregnancy. Some too is because they are financially not stable. But with the ones that are not financially stable, we try to educate them with the things that are of low cost to be able to afford and feed well on them. And then the ones that have collaborated because of the pregnancy, they are not able to feed. We also educate them on how to go about it. For instance, they should be able to feed in every 15 minutes in a bit. And then they should also take water, at least not less than 6 glasses of water. They can do that and take. And then currently, our delivery that we've done so far, we have a delivery of 98, which we started in April to November currently. F Alpha and Omega Specialty Hospital deal with health insurance. Any services, anything we do here is for free. So far as we have health insurance, our services, medication, and everything is for free. Thank you.
So as long as it goes on that we come to agency, we used to check teacher height, we know how baby is doing, Even the condition of the mother, the state of them, because sometimes you come here, when you check the urine, there is protein, great glasses, good glasses. So that simply pre-eclampsia. So without they coming for ANC, they are not able to get to identify those things to know how to go with them. So we keep on educating them on the importance of the ANC attendance and then the early booking for the ANC. To know whether the baby in the utero is safe to carry for them or have to do something about it before the client gets to them. And then we know those we book for the CS, the electric plan. So when they keep on staying in the house and there's something else to do with them, we can't be able to. That's why we encourage them to come to the regularly, frequently, and then they should be active and the way we do education with them, how it will help them with their problem with the
Antenatal care ensures that every mother is equipped, supported, and celebrated through her pregnancy journey.
And now we are establishing a facility center or IVF center. This facility center, we are going to commission it in January 2025. And this facility center is going to be one of the ultra-modern center in the country. By the grace of God, we have our partners from India who are supporting us technically and all the necessary equipment that we need. By the grace of God, they have come. The engineers are working on them, installations and the calibration of the equipment are being ongoing. And we are hoping to complete all this thing by December ending, so that by January 2025 we inaugurate this facility center. And the focus for this facility center is to help those in need. We have come to realize that childbearing has been a big problem at this time. Some people are losing their marriages, some people are even losing their life because they couldn't give birth. Fine, I understand them, because infertility is not something even Bible encourages. According to the Bible, it said we will not see bearing among us. So God is even expecting everybody to give birth. So if someone is not able to give birth and the person is so much worried, sometimes we have to understand them, we have to encourage them. So if God in his own wisdom has given the knowledge and the opportunity to mankind to be able to assess our own, money should not be a stumbling block to those people who need these services. So we are coming into that service also to ensure that money should not be a big challenge. Here in Ghana, the services ranging from sometimes $6,000, $5,000, and it's not easy. Many people cannot afford, but they need the service. By the grace of God, F Alpha is coming in with very affordable and ultra-modern standard services so far the fertility services is concerned. And we are taking this opportunity to assure the whole country that from January, all those who need this kind of service should pass by, and they are going to get their baby. Here, when you come, you are coming to get a baby. You are not coming to look for a baby. You are coming to get a baby from God through us.
For those longing for the joy of parenthood, IVF specialist services turn dreams into reality with cutting-edge care. At F Alpha and Omega Specialist Hospital, every step of care, from diagnosis to recovery, from routine checkups to complex surgeries, is fueled by a singular mission: to heal, to restore, and to serve at no cost to patients. This is more than a hospital. It is a revolution in care, a beacon of hope, and a proof that quality healthcare can truly be for all. F Alpha and Omega Specialist Hospital, where healing meets humanity. Nestled in the heart of the Oti region of Ghana, Dr. Bewa Memorial Hospital at Ketekrachi offers more than just healthcare. It extends compassion, love, and life-changing services to people of Ketekrachi, surrounding villages, and island communities.
We do surgeries, and one important thing is our services are free. It is free, let me say it is free, because here when you have active health insurance, we don't take any top up. We don't take top up or co-payment. We don't do co-payment here. That is the policy that we are offering it here at Dr. Beria Memorial Hospital. We do attend to 5 to 6,000 attendants in a month. 5 to 6,000 attendants in a month. Our coverage is very huge. Here we cover from Bono East region, that is Sini East, KJG and its environs. They all come to Krachi. We also cover from Krachi in Chumuru, that is Chendere district. Over there they don't have a hospital, so they do refer their cases to Ketekrachi. And also the Krachi West, the Dambai, that is the regional capital. Over there they do not also have a hospital. And as I'm talking now, we have about 30 people coming from that Krachi West, Krachi East, that is Dambai. Today they are here for surgical procedures. We are doing surgical outreach this week. Every month we do surgical outreaches. Surgeon comes from Accra, Kumasi, and we organize surgical. And last month, September, we did about 76 cases. Yeah, 76 cases. As you can see, we are serving under 3 or 4 districts. So our number or our clientele base is very huge. And one interesting thing that we also do is that here we have about 52 island communities. That is the Krachi West alone. Krachi West alone. 52 island communities. The Sini East one is not part. The Krachi Jumru one is not part. So the Krachi alone, we have about 52 island communities, of which all these island communities, they all also fall when it comes to the healthcare delivery. They also come here, and we do go to them. One challenge that we are facing in this district is those people living in the island. Over there, there's no hospital, and there are many people there. I can say that those people living at the islands are more than we ones that are living here. So regularly or sometimes we do go there on outreach basis. We do go there on outreach basis. We go there, we attend to them, we screen them. Those that we identify their challenges, sickness challenges, we refer them. Those that they need medicine like antihypertensive and diabetic, we do labs, and then when it's confirmed, like typhoid fever, malaria test, and then we attend to them. Yeah, we attend to them, because for you to come from the island, I mean, it's very difficult. They do come to the town only once in a week, and not the island communities per se. We do go to the hinterlands also, but here car normally doesn't go to our villages, and there are many people living there. So if you don't go there, they are there. So we go there. That is, we do community outreach. So we offer healthcare delivery to their doorsteps. We go, we do them, we screen them, and when we identify challenges, that is why we bring a lot of surgical cases. As I said, last month we did about 76 cases. Most of them is as a result of our outreaches that we go to these villages You go and then you see the cases over there. They don't have money. Even if they have money, car doesn't go there. So we go there and then we manage and then we transport them. We use our car to bring them to the facility. This evening we have a lot of people around and they have come for the surgical. So Dr. Bear, we are by the grace of God for the past 6 to 7 years. God is helping us and we are doing marvelous work here. And that is it. We are doing marvelous work here. I can say for the past 7 years, we have attended to more than 100,000 people. 100,000 people.
Through rugged terrains and long drive hours, the hospital's paramedics travel to remote villages like Pichiakra to deliver critical medical care to residents battling various ailments, but with no means to travel to Kitikrachi for treatment.
Dr. Bowie wa boy wa pa bra ba ha first no ba say obekire say yembra ho doctor mu no hwe mpanso enyina otimi sheda mai na etwe no odika be fa ya ko free akofie free yenso a wo hwe no yehu si ahoni bampa e bona ba se yemi nyina na chi no ntimi boy sa to ndenso o wasa ba no ndi egia ne su bim sejina na chisi osaba no nipa dom nyina nso omunsa wo fukuruma ai obebre yare ti nansa bia otwa awamba ha na hai kakra ti oba no aye nyina de ti eso no so onhwe ye hwe mbre atwom na pechi omudika eba be fa nipa ekọ hwe omo afi nyami adonte omo kọ a yare anka ha omo no nyami adonte yare ne ekọ ndenso masatom na abakro yi mu ababa hwe nipa a ewa ha afi ama wanga nkane wantumi nko sidobia anya access atumi aba abeji ayare sa ewo pechi ha ena Dr. Bawia a wa Afrikrachi aba pechi kurudua mo tena kan se yeda na ase ete ebesese abre nyina wantumi mbra ha na afi mo hwe ayarefo ne maye yemi adum te bibiri akwa ayare sa nkane na wantumi ye atwuma o mo atimi ahwe mo ama mo anya ayare sa nti yeda Bawia ase pechi man eda Bawia ase nyamisra no na afi ndwuma pa we no onkososa onye na afi entren kwa wi asa ama nyina so
ma o se hospital na abuaye mi ban mo yale omo ba ha na ye ko hospital mo ma nya yaresa ahunto aba me hu me ne me banso me da nyankopo ase na me da hospital no so ono so ase de waya ma me no adoso me nim sambe ye no me bompa so wan san ya bin kan ho ma me na ho to samba me so te tambia madam for no mo ba ha no mo aba fa ya kwa Krachi hospital wa bo we ya doctor mo o mo fe ye de nkwada nyina kwa o mo ahwe nkwada no mo nyina o mo anya yaresa o mo nyina anya hwandin nte o mo asa ba ha nde no aduro am asa maye no sa aduro no meji atambia aduro no agimani me numa me yare ni nyina na akwa ama me nti ya da Bawia na asise ade a wa ya ma peche kura no aye ma ye pa nti wan bua ya na yan kwasa.
We don't have a clinic here, but God bless so good today. You brought the clinic here so that you are taking care of the children. Sometimes the children sometimes they don't come to school, all because they are fallen sick and stuff, and their parents will never send them to the clinic or hospital, all because they were going to farm and stuff. So when we find out that the child is sick like this, we can't first give them any treatment because we don't want to find ourselves wanting. So we tell them to come home in case they have something. You find them on maybe getting to a week, the child will not come to school because they are just treating them on their own without sending them to the hospital. But today, God be so good. We had the clinic here taking care of the community and the students as well. So we thank you so much for what you've done.
dwumadie no baeɛ no mfa ne sɛ pɛkyɛ kura hanom no ɔmani agye papa because me baeɛ yi a ma ba beto ɔmo endra ɔmo gye me so pa ade kyenyɛ so a me baeɛ yi ɔhene no bodawuro ɛma ɔmo de nkonya edi aba behia nti ama ɔmani agye sɛ saa yi Dr. Bawia edi saa adwuma yi edi aba ha ende ne de na nyame anim ɔmani agye papa ɛna adwuma no so baeɛ nso no me gidi sɛ ɛbɛyɛ about 7 years nie area hanum nyina adi Dr. Bawia amfa so bebree efi sɛ ɔnam villages a ɔde ɔmo kɔ ɔnam atrite ɔhwe ɔmo nyina ama BP ne saa ayi yare nketenkete ni nyina malaria ni nyina abrasi.
The people here are sometimes taken to our health facility to go and take care of them, but looking at our car, the people here, most of them are being conveyed, but I think when we come for the health screening, we give a more screening to a lot of people than when they are taken to the facility. So I think the screening is more important. And during the screening, looking at the health conditions, we educate the clients on their health conditions. So as some maybe when the client comes with anemia, we educate the client on the food the person should eat, and then other stuff. And then sometimes when the client comes with maybe diarrhea, the diarrhea is most with the children than the adults. So we educate the clients on what they should eat or what they should give their children, the hygiene and other things they should put in place so that the diarrhea and other things.
For those unable to reach the hospital, the team organizes transport, bringing patients in need of care to Ketikrachi and ensuring they return home healthier and stronger. Beyond Ketikrachi, the hospital reaches out to about 50 island communities, most of which lack CHIPS compound or any health facilities. Medical teams navigate the voter lane, sometimes for hours, to deliver vital care to those isolated communities.
We are embarking on our medical outreach, which we are going to one of our islands. We normally come to them because here is an island and there's no a clinic or hospital. So we do come there with our medical team, doctors and nurses. And you know, Ketikrachi or Krachi West District Assembly, it has about 52 island communities, more than 52 island communities. And all these communities, most of them don't have a CHIP compound or a hospital or clinic. Island is about only 2 that is having a CHIP compound. So people living there are really very suffering. So as part of our social responsibilities, we, Dr. Bawia Memorial Hospital, we've been in Krachi for about 7 years now. And once in a while, we come to these people and then we attend to them medically.
We have visitors from town, doctors from Bawia Memorial Hospital, according to them, they would like to help the community. We are very happy about their coming. Simply because at times we find difficult to go to hospital whenever we are ill because of the wave.
As in about the first year, and you have me auntie, you know me, Yapana Mobahari, Meho, Atike, Alamashi, Yakoja, medical day. I put the county, but I'm a sure materials like or Jihadi, Ecolum, or Attica, affirm.
So the exercise has been fruitful. We're able to detect some of the patients with high BP for the first time upon several rechecks. We realized that most of them were farmers, and then they were having these chronic pains for which they buy the drugs themselves since there's no facility available. So we were able to also get most of them having drug-induced gastritis. And then we have some of the cases, surgical cases, that we've been able to refer to the facilities for which we will continue treatment. Some of the children came with severe malaria, and then we have also referred for further management. They will be coming later, and then we will continue service as free.
At places such as Old Nanasewe, care reaches where it is needed most, offering hope to those with no other options. Patients even travel from Dambai, the regional capital, to access care. Dr. Bewa Memorial Hospital performs free surgeries, including emergency wards, all covered by the NHIS. For NHIS card holders, all services and prescriptions are free unless excluded by the scheme. Those without active cards are assisted with registration or renewal, ensuring no one is left behind.
We intend to do elective surgeries. Number elective surgeries are surgeries that we booked. They come on their own, we write their names down. I will schedule them on a particular day to come so that I will do for them. But this particular one is an emergency. It's strangulated right in gynecoscopic hernia. And because an emergency, we have to stop all what we are doing and then do this one. As usual of OT region, if you don't do this one, they may have to travel to other part of the country, which will cost them a lot. So that is why we have to do this one. And today we have planned to do about 30 cases. Today, tomorrow, and then within the next one week. My duty is to give the patient anesthesia. Anesthesia is supposed to take away pain, so the patient will go through pain-free surgery. And this particular one, I'm going to give the type of anesthesia we call spinal anesthesia. That one, when I give the injection, it will numb a portion of the body, not all the body, so that when we are doing the procedure, the patient will not feel any pain.
Here, there are so many cases that come here. In Kwanta, Dambai, Kitikrachi, we see so many surgical cases. They range from the most common in surgical practice, which is hernia, which here, because the people are they are, let me say, primary workers, they are farmers, they are fishermen. We see a lot of hernia cases, right from pediatric hernia, umbilical hernia, inguinal hernia, to adult hernia. Even the women, especially the inguinals and the femoral hernias, we see all of them. So you will see that there are times that cases will be referred from some of the district hospitals, maybe because their instruments are not, or their conditions are not adequate or right for the moment, or maybe the case is major, that you need a specialist care. So we do all those cases, peritonitis, sometimes we do resection and anastomosis, we do colostomies for cases, let's say for example, typhoid has been operated several times and it has broken down, there is leakage, so you have to go in and do anastomosis or ileostomy to solve the situation.
There are also fibroid cases. Many women who are fibroid, so we can collaborate with the what we call obstetric nurses. They do the pap smear test for us, and then when we find out there is no risk of CE of the cervix, we do hysterectomy. So, and sometimes myomectomies. We have doctors who come here, they come, gynecologists who come and train the staff. So anybody found in OT region, all the doctors, they, even the young ones, they have experience and surgical experience. The different operations, you know, surgical operations, they are ample. Sometimes amputations, raisins, amputations and all those things. So there are so many cases. I can't mention all of them.
Here currently is the antenatal room, together with the scan. So we run antenatal, which is the unit that takes care of the pregnant women. And also we have the maternity aspect, we have the labor ward, and on. We even take care of gynae cases as well. Okay, our services are basically free, right from taking a book, that is when a woman is able to identify she's pregnant. The book is free, the labs are free, to the care that, and services that are rendered, they are also free. Labor and delivery, free. The medications that are given, free. So right from the start to the end, everything is health insurance covered. There's one challenge that we are facing with the pregnant women currently, which is the anemia rates. When you talk about anemia, we're looking at a woman with a hemoglobin level of less than 11. And when it's severe, it means it's less than 7. Now we are living in a community where we have islands. So sometimes we would have to go out there and then help them or encourage them to come for antenatal. And those ones we are even fortunate to have. When they come, it is at a later part or section of their pregnancy. So that is also another challenge. And all boils down to the fact that the family support is down, especially with the husband. But one way or the other, we are still dealing with it to help or get the husbands involved in the pregnancy process up to delivery and even the postnatal. One thing is that our mission is to get high quality care to most people, in fact all across us, looking at the environment we find ourselves in.
For records, in a week, it makes about 700 attendants, and with the Breno Bonus Insurance now, your office, I will renew more. If it is active or not, let me attending to Omo. This is the pharmacy department where we have medicine and where clients come for their medicines. Most of the dominant medication are the BP medication, diabetic, then diarrhea and malaria.
Patrolman so me free than by I'm a bad doctor, but we are hospital in the year, and then my first time I'm a bar. Me say yeah surgery amount for I'm so me wo henia inti, and then I'm so me do her my be surgery.
Yeah, me ba doctor ba we are. Omo ye yi akororo no me kunu so menu ya de ba nyame anim nyame adi aboa mo atimi aye ejojojo amahwe ya ma
me frequenting na me te say Dr. Bawia Memorial Hospital omo ye surgery efa henia ho entina ba me yare ne che me be se 5 years ni te me ti omo nkana na me se me ba na mabeje ayaresa
me freedom by is in run again na me ti say omu operation e wo krachi ha ntin rana me ti adachi na me bua me ho say meba na so operation no me yedi kan ko yebi 2009 manya ko operation 2009 samba no we ne ketwa bi yenyini afi ne eno nso anyi ane nso asada beti akọ mishuwa ntin dra me tie na me send it sa meba check up abetwe se na eti no eti na me bai.
This is Healthcare for All offered without recourse to finances, welcoming everyone with open arms. Dr. Bewa Memorial Hospital continues to touch lives, building healthier communities in and across Kitikrachi and beyond. This is not just healthcare, it is humanity in full expression. As the first rays of November 2024 fell on the horizon, a new chapter in healthcare unfolded at Denasi, a community located along the Kumasi-Ofinso Road in the Ashanti region. St. FF Specialist Hospital, a new hope for free quality healthcare, was born. With this grand opening, St. FF Specialist Hospital became the sixth addition to a growing chain of healthcare facilities devoted to a bold and noble vision of delivering quality healthcare accessible to everyone and absolutely free.
Choosing Denasi, and for that matter, this particular place, is not by chance. We have realized that from Techimai up to Kumasi, on the main road, there is no any hospital. There are a lot of hospitals, but every one of them is in a branch. You have to branch before you get there. So most of the times, people who are traveling along this road, when they encounter a situation whereby they needed to visit a hospital, sometimes they find it difficult because some of them don't know the branches or whatever they have to go in order to get the health care. So we decided to locate this area so that by the grace of God, through us, we can provide such services that patients need. We have come here with our model of health care services. There are a lot of hospitals under our management. We have a hospital across the country. These are six hospitals. And among all the six hospitals, we run a spectacular model. Number one, our focus is quality health care. Health care is nothing but the quality. Patient visiting hospital, everybody visits the hospital. Everybody provides health care. But the question is, are the patient getting well? Are the patient getting what they want? And that, by the grace of God, has made us what we are now. If when we started running the hospitals across regions by regions, and our services are not that quality that meet international standard, I don't think that patients would have patronized our services for us to grow to this point. By the grace of God, everywhere we go, we are unique. Today, we are here. You have seen the crowd. As at now, it is 15 minutes past 3, and we have attended to over 200 patients today, because every patient has heard of our star of healthcare businesses. Because number one is the quality. Number two is the patient-centered. Our focus is not on money, but how our patients will get well, will get what they need before we think about money. So in all our hospitals, we don't take money from our patients, provided the services are covered by National Health Insurance card. All our hospitals. Currently, we have a hospital at Kitikrachi, called Dr. Belware Memorial Hospital. It's our hospital. By the grace of God, the people in OT region, they can testify that even surgeries, we don't collect 1 cedi over there. That's not the only place. When it comes to Kumasi, we have Royal Place Hospital. That one too is located at Abrim. They popularly call it 18, Kenya Abrim on 12 Road 18. That place too. Over there at Abrim, the same area, we have Right Care Hospital. They don't want to take Obwasi Road. We have Dozenic Hospital at Pechi number 2. And here we have St. FF Specialist Hospital. When you go to Accra, Medina, Powerland, we have Alpha and Omega Specialist Hospital. And all these hospitals I've mentioned, none of them is collecting money for services that are covered by NHIS. No. Once you come and the service is covered by the NHIS, whether it's surgery or whatever, we run it for you for free. There's nothing like top up. That's our hallmark. You can see here, NHIS accredited without a top up. So we don't take anything outside what NHIS pay. We only take money when the drug is not covered by NHIS.
St. FF Specialist Hospital is a healthcare facility that provides specialist services. We render services like eye clinic, ENT, general surgery, and all kinds of special services in terms of surgery. We have laboratory services, we have pharmacy services, and our utmost aim is that we bring health to the doorsteps of the people. And so St. FF Specialist Hospital seeks to accept the National Health Insurance Card in attending to sick people that are in need of health care. And therefore, we have collaborated with the National Health Insurance to ensure that every patient that comes to St. FF Specialist Hospital receives treatment at no cost. And also, not just treatment, quality treatment. St. FF Specialist Hospital boasts of itself specialists, gynecological specialists. We have general consultant in surgery. We have a specialist in ophthalmologist, and we render a wide range of services. We render services for communities around and within Danase, and this is one of the facilities of the Francis Fosu group of companies that seeks to bring health and well-being to the people of Ghana at large.
Sa hospital yi eyeyenya dia ye bedi nini ye ma meye no basa me pese afeda sesebra ha ye nyina ye nsan hie mo ye first anniversary no na ha ye kama te se ne ye huni ne ya e beba de sa de se mo amo ba mu no mo amo ye adwuma wo mu no munyina mo fa no se eye mo dia ne mo menya Mr. Fosudia enti saase mo ina me di beja mo management staff community mo fa no se mo dia health insurance mo nsem de ya ka ni nyina ya ka bebre abri ni bribia ye bom ne jaru mo den asa mo card watu ne ho asi ho oso obeya ama mo free umpe we na apede enti afe no ba ba so na no de mi kanu aba no abewinio e ma wo card no mpa ho da na Mr. Fosu me pesa me bo abaso efi se on my Ghana se wo hwe facility to population ratio ya kamukra sa 2030 ya ka se ye pay universal healthcare ama Ghana fo nyina no provided access no ya de to amai kwa so a enye yi hwe se Ashanti region kwa wo saying and line enti wabua papa onyame onsha
Mr. Fosu abua healthcare access to healthcare our country ha facility na ye bebie enye no ne the only facility a wabie e so mako we ka ho abe enum ebi wo other regions e na dodo no so wa Asante mem ha sei na ye nyina ye nim se enu 2030 the year 2030 no e was say nipa bibia wo ewiase no wonya access to health care without financial risk. Just access ne say ukọ animu a ubenya ekwan na ubenya apomuden amayahwebo ana say wuntua hwe na enne de ye me de ye pa ne say o se area mo say nyina no obeboa ne register enipa 20,000 e wo health insurance say de be ya o mbetim de abehwe mapomuden e ne gisam kase pa enti me ka kire amanfo a omo wo dinase ene ne mpotem nyina say omo fa kwanya no na wo muntimi en register no muntimi access to health care if you say wo apomuden a na wutimi ya ade nyina enu nti no eye ne gisam kase na misofosu de the facilities ne de eye ahomeka awo ho ne say the facility nyina no ukọ ho a wo the health insurance cover you don't pay anything won't you ahwe operation na wo be ye o awo na wo kọ wo wontua bibia ne gisam na me stress hospitals afoforo no omomo wode aso omo besua said de be ya enipa kọ ho a ontua hwe na end defeat the purpose of the national health insurance na apomdin si achi ba na aban ede asi ho amagana fo no enti enne eye enigisem da kese enti na ye ba ya ebebo ni chidom no
kakra ye kan say yenta doctor me the news on ye more by say problem dey ama but we shall give our best to protect the facility, the working staff, and also to have a very good environment. Obidaha, Oya Risa, as we know, and then for that, I said before that year, or that year, and as I conform to us also. But I don't think every night to pass around to ask the witness what are their problems and so. So that's our reason to do the hospital.
So share Jumawura, Nitrimo Po, any swadi who Yankupon Diama, HS area ha, Ebabua, and Nipa Wahapa, Sunset, Hadia Uba, insurance no wuntia capre, wuntia bibi, and Sunny actual operation crana wuntia capre cra. Na years a crowd diamond, Munina Modim Pibo Betanechi, impending for. A summary man I him for ne a titro no or you'll be also young ready by botanechi and the empesa mechanic said one would ye woo ye no a year radia or no dinner what to know so Christa what funny sunny craging quano and the money to me yet near and ne any public brave the hospital will be a no when a tosso ensia or be no. And in Tina, they make catch on the wounds of our woman ready. Fisoba, no one ya pomodin, said ye, Nasa, will craning quadia. Bible say, so Nipanya, we are seeing your men in an ocean and cry, and Pasobe no benya. And in T, Wabahano, she shall crown quadia. Nanuntina, yes, you subetia, your bonny kamayan, so over funny so craging quack. No dinedia radivasi sanwo Yesu Kristo dimo. Amen.
We are so much grateful to the Lord for such a facility. And in fact, we give praise to God for the vision our brother has received to see to it that the underprivileged in the society will be able to receive practical health like this. But then it is good that he does all these things. But the Bible says, what does it profit a man if he should gain the whole world and lose his own soul? And so, in the light of this, it is good to see for this medical help. But then it's also important that one gives his life to the Lord Jesus Christ, because he is the greatest physician. Without him, all else in life is vain. And so I would like to advise the larger community that as they come to seek for medical help, they should also seek for their salvation, so that later in eternity, they will be with the Lord and not suffer anything in hell. Thank you.
There is something special about Mr. Fosu and his facilities, such that it is one of the hospitals where you go and then you can be fully assured that you are not going to pay even a penny, so long as the service that we are going to access is under the National Health Insurance Scheme. And we are here to support him, because if someone charts a good path, it is proper that as NHIS we support that person. Not only that, as part of his processes to get more people access to healthcare. Every facility that he opens, he also gives people access to register with the NHIS, fully funded by Mr. Fosu. So today he's registering over 20,000 members onto the NHIS. And it is our belief that once this is done, it will further increase the numbers that are on board the NHIS, which will further improve upon healthcare delivery in this country. It is our hope that our journey towards UAC by 2030 will be promoted by this gesture, and we encourage all facilities to also emulate what has happened today. We at NHIA are always prepared to ensure that everybody gets access. So when we see such gestures, it is heartwarming that individuals could do this. So we are fully supporting his projects and hope that others will also follow suit.
It took off with a remarkable initiative of registering 20,000 clients on the National Health Insurance Scheme. At the premises of the hospital, families lined up in anticipation, children clutched tightly by their parents, and the elderly assisted by caregivers to be attended to. On-site NHIS officials worked tirelessly, capturing details, issuing cards, and ensuring no one was left out. Inside St. FF Specialist Hospital, the promise of quality health care comes alive through a comprehensive range of services designed to meet the needs of every patient. These include general OPD services, inpatient services, ENT clinic, general and specialist surgery, antenatal and postnatal care, pediatric care, obstetrics and gynecological services, eye clinic, laboratory services, pharmacy, and scan services. With these offerings, St. FF Specialist Hospital provides care that is not only accessible but also holistic. This groundbreaking partnership is more than a gesture. It is a powerful statement. St. FF Specialist Hospital and the NHIS have joined forces to prove that healthcare can be a universal right, not a privilege. St. FF Specialist Hospital is more than just a building. It is a promise, a commitment to the people of Denasi and beyond. From its very first day, it has set the tone for a future where no one is denied care, regardless of their financial circumstances. The dawn of St. FF Specialist Hospital reflects what is possible when compassion meets innovation. It is not just a hospital, it is a place where hope and healing meet humanity. In the heart of Pechi No. 2, along the Santasi Obuasi Road in the Ashanti region, Dosanek Hospital serves as a lifeline for countless individuals and families. Here, quality healthcare is not a privilege but a promise accessible to all. 24 hours daily, Dosanek Hospital opens its doors to the community, offering comprehensive outpatient care. From minor ailments to serious conditions, the hospital's team stays committed to diagnosing and treating with precision and compassion.
The clients who come here are very, very happy with our services. What we do, they are very, very okay. Because when you come here with NHIA card, you don't pay anything. Everything, all the services we render are all NHIS free. There are a lot of services we do here. When you come here, we do ONG, general OPD, eye, lab, and then pharmacy. They are all run free. All the surgeries are done here. Hysterectomy, myomectomy, hernia, and any other surgery you can talk of. all these surgeries are done here, and they are done free with NHIS. They are all done free. In fact, if you go to the community, especially all the towns around the hospital, they are all happy, and a lot of people are coming here. We are seeing around 300 clients a day, all because of the NHIS. We are running free. If you deliver here and you have insurance, NHIS card, it's also done free. You will deliver, and when you are done with all your things, you just take your baby and your bags and you go home free. It's all because of NHIS. We started last year, that is 2023, October there. So it's about a year now. We've registered 10,000 patients. NHIS, we've registered them free. Once you come here and you don't have it, we will do it for you, and we will take care of you, and you go home free. If you have it and it has expired, that one too, we shall renew it for you, and it's also free. So you can see what we are doing to help the community, both Pechi and then the surrounding suburbs.
For expectant mothers, Dosonek Hospital is a sanctuary of care, providing antenatal services that ensure safe pregnancies. From prenatal checkups to postnatal support, every mother and baby are given the attention they deserve, free of charge, under the NHIS.
Na higher maternity unit. Yahano yasha painful. Kopem say, Obosomen Krobeso and Wobekam. Near Sajo. Yaha was canwa. You'll be higher health insurance. Yeah, just a free service. Lab free. Everything free. And no one is a who crowd health insurance. I spy crowd ba. Ye very new amount. And Tiamaya had ye. Eni pebusu sa. Tiana mame fone kasa bebre ba no pa de awrade asema omo. Me anam de ma omo. Me wi anam say educate omo on importance of ANC clinic. Say ye here. So baba clinic opim say obosome nkono ebe so. Na nyame aboa no aboa ye so. Ne age wa wono afa ho. Afa wo ba asundwem. Ye bibia so ye use computer. Ye mfa card nya adwuma pemfo nko a. Ne yɛ card ma om case wo tu kwan na bibi kɔto na o de akɔ clinic de aka nyina no health insurance bibi a computer so ti bibi ani hɔ a ebe ha adwen ɛwɔ ha.
Here we see a number of clients, both female, male children from 2 months up to ages. The number of cases, at least in a day, in the busy day, we were able to see about 250, sometimes 300 in a day. But when it comes to weekends, at least 150, 200, we're able to see up to midnight. Then the trend of condition we normally see here is hypertension and diabetes. For the past 3 months, we are able to record vitro, which is HIV infection, which is predominantly reoccurring in 3 months. So, although we don't offer the HIV antiretroviral drugs here, so when we screen them and we have adjacent hospital where they go and take their drugs, Dominase, Ahrian Kwanta, Bekwai. So we do refer them to go and take their medication. But when it comes to the HPT and diabetes drugs, we have enough here, so we're able to supply their drugs. And all the labs, the chemistry, we do them here. Only if you have insurance, it's free. Everything is free here. The drugs, the OPD, the labs, everything is free. So far as you have insurance. If your insurance is working, everything is free here.
So be we see because of the way, because of said you see emma kasa ana ye mo mu no ne chechom ne omunni efo mapomudi efo o message yare hunti no ama nkofo bebre ni je certain bia no baba Dosane hospital e na afa bie mu so moja broso ye ma ame no moja no ekoso ya mo ntimi moja ni ne afusan ye no de ka ne BP no bebre timi eba ha se sanse ye wo mra de chechom se no besi afo mbaduro o mbedi die ene ha waduro no fa de besi ebo mo pressure na na se moja broso no ebe kopom ama wo mo.
My sister been a day one dance a chairman. Or say the buy a ray, or the ne buy. Obi so train or the ne buy or buy no. Or mind in a shade, Nessie for no so any muti. Until no shed and jindy. And I, or 2 and a month or the never be the manta for me. I don't buy it, or be free, or and one song was in your minko, or some aminas will say, or so winning your minko, or so and yamia. Just what to see was the speed of the choir, somebody almost unfriend the back. So buy an over money. It's a miss me, mammy, you know, you're and I'm saying that Miss me to an among a bisana maba. Miss me buy a woman, you know, back on the genital. I dare chain a mantra 1 city, a shock came, in fact. Even cut the cry, who could be a card, who could you crown 50 cities, mantra 1 city. Omani motse omodo nipa said omokasa nipa ho ada hospital no nya ne sa ntimi ameyare ye no mafafu nsidade sorry and me ho nya mi yi se menya ne free de me ntina ho na mi ana me de me kadru.
When emergencies arise, the hospital's surgical team is always ready. From general to specialist surgeries, Dosane Hospital performs even the most complex procedures, ensuring no patient is left behind.
But me ba ha say na me wo yare bi a friend fibroid da me yefuno. Na me ba Dosane Hospital I wo pechi. Say me ba na ma ba be yi. Me ba yen so nurses for e wo ha say omo receive me fe ama me ni age pa after surgery no so like omo services ye fine bibia ye okay like omo ni mutte insurance and so am dey buy nti ama surgery no ma anje me sika o ma anje me hwe
na me ba fisi a oben eyale ye be ye no operation e wa ha se oba e che se nurse form wo ha wo che se mu obi a wo pemuna obi ni mutte na de ye me nwanwa ye me de kura ne se yesi che se wo be da ha no a 1000 kura ye nyu eye me nwanwa papa ti ye de mo ase pa se mo de sa ni mo nyam we e de abakuru due so wo be da ha na wo health insurance ya ye nyu hwe se me kura me di adanse e kire nkrofo se wo mo mra ha na se ha no mo de ye nya hospital pa kese e wa
Dosane Hospital ha no se omo ya de pa omo enipa se fa nipa ho hwe omo ya de me ba ye kromo ye tu ba me be wo na me ma ha no antinenta but me ba ye no omo ti omo anim hwe me ehwe me wo ye omo anje me 1 cedi kra omo ye good me sa de me ba pani ba ha wo insurance ya anje eska bia omo ye good pa doctors omo anim tenets for no so anim.
For NHIS card holders, these life-saving interventions come at no cost to the patients. For the youngest in the community, Dosane Hospital offers pediatric care to meet their unique needs. Here, children receive not just treatment, but also the comfort and reassurance they need to recover. The hospital's pharmacy and laboratory services ensure that every diagnosis is backed by thorough testing and that every prescription is filled without delay. For NHIS card holders, these essential services are provided at no cost, creating a seamless healthcare experience for all. For those without the NHIS coverage, the hospital goes the extra mile to facilitate on-spot registration and renewal of expired cards. At Dosane Hospital, healthcare is a right, not a privilege, ensuring that no one is turned away due to financial constraints. Dosane Hospital is more than a health facility. It is a lifeline, a community partner, and a symbol of hope for the people of Pechi No. 2 and surrounding communities. With every service it offers, the hospital reaffirms its commitment to making quality healthcare accessible to all. From outpatient consultations to emergency surgeries, from maternal care to pediatric services, Dozenek Hospital remains steadfast in its mission to care for all, one life at a time. Located in the vibrant community of Kenyase in the Ashanti region, Royal Place Hospital stands out as a symbol of accessible and reliable healthcare.
Royal Place Hospital is a hospital that has a very good, conducive environment for adequate patient care. We have a lot of services we offer here, including general surgery, obstetrics and gynecology, and general OPD and emergency care. Since I joined this facility, there has always been different continuous improvement in our quality of care we offer to our patients. One of the things I will always want to say and never forget to say is the fact that there's free NHIS service here that works so well. I mean, it works so well that the attendance is so huge. Every patient wants to come here because there's very less burden on the client. I personally want to say that it's something really worth talking about. I who basically live in Accra and I'm now living here and working here can testify that this free NHIS service is something that has really gone a long way to help the patients. Even I as a doctor, sometimes when my children fall sick and I have to spend as much as 3,000, 4,000, 5,000 Ghana cedi just to take care of them in hospitals, I can appreciate the way this hospital has really made it much easy for them, such that there are a lot of patients coming here from all over Kumasi, even to the extent that I have also had referrals from Togo that came here that I personally saw on the general medical ward, not just because of the free healthcare delivery that is here, also but because of the quality of care according to the patient, smiling and going back home and could not have words enough to say, yes, I was told that this place is good, I was told that this place is free, and I came and I'm really a testifier to this fact. Okay. I would also want to say that Royal Place Hospital, apart from the fact that we have a good team that takes care of our patients, we are always aiming to do better. We never have an end to what we do. We are always, if you come here some time ago, you come and find out that if you come here another time, things have changed. I also want to really say that the administrative body is our word recommending. Mostly we as doctors sometimes have a lot of problems with working with the administrators. But in this facility, I must say, when I want to ensure that my patients receive the best of care, whatever I come up with, the administrators never turn me down. They are always there to ensure that our patients are happy. They are always there to ensure that whatever is needed is gotten. So I must say that I don't have a problem working here as a medical doctor, and I must say that that's good.
Yeah, you share general side. When I'm your the insurance nearby, you free with a active on Quadia. You won't pay any top up. Won't you share was so? You share new or you share so her. You will lab or her. Doctor request lab, obey your baby and son or wako. You will eye surgeries. You will eye or her say. We have a lot of package. We have the ONG here, we have the maternity side, we do our ANC, we do CS, we do general surgeries. Into ye nema bebre e de boa on my Ghana. Into the year can say yes stress say move from Royal Place Hospital. We sell ourselves because we have quality doctors and midwives and administrators are also there, and we have quality drugs too.
This outstanding facility offers a full range of services, and all of them are entirely free for active NHIS card holders. From the general outpatient department to their comprehensive inpatient services, patients are assured of care without compare. Their specialized services include ENT clinic, general and specialist surgeries, and comprehensive antenatal as well as postnatal care. Royal Place Hospital also caters to little ones through their pediatric care unit, while offering women-focused obstetrics and gynecological services. For those in need of additional support, they provide eye care, a fully equipped laboratory, scan services, and a well-stocked pharmacy, all designed to ensure that no one is left behind in their healthcare journey.
Enura be no me nutam na me hu sem me hu ayeshishishi bitia mi ya awodi mi da me baba ko teacher no ko school nti oba ya hu se de me da wa me ye no ka se ma da bi enim de be si anadu be mbra nti e beduru ha na ekobo 6 o me ba ya nsu o mo achichiri mi sakama ahwe mi BP eno mo ma me ko doctor ho me ko doctor no doctor hwe mi eno ka se obeji me atu eno o chura duro eno me ba no ko he nti okoye no omuma na aduro omuma na aduro kama ye edu betu mi so eno mu ka se pani ani de omuni eno omuma mi pani nti me ba eno omu eji mi to ha eno omu wo mi pani no mu twiko asa eno omu di so si mi so kakra bi no omu aba mo hoye na makasa ai no mo abe check mi BP omu ahwe kama awo machi boy 430 so no omu saba eno sadi so no aka ni si mi so osawo mu panu nti chiro no kasa doctor bayembra ye ko na doctor bisa mi set say ene mi kasa nyame adum eye awonu nyina ko miti na epami atomi ene doctor kasa ene wo betura aduro ama mi nkoji o mi ko ensu o mu di aduro ni nyina ama mi ene o mu ka kira mi say aka panie ba ko enu no nsia ene de bewo mi na makofi nti mi da wa mi twe aduro ni no nsia ba na se nyame adum ne se duwa o mu wa mi na makofi o mu aya de o mu ahwe kama Omashem kama mantue bibia
na se na mo stomach ulcer enti na madam fudi kan for Royal Hospital emani nti abra mi titi no eba ho no mi behia nurse for no ema omo he ma mi ko hu doctor abra mi ko hu doctor no e wo kire mi ndure wo se me no nti se am yefu ni ade ni nyina ekọ adigi am ntimi ndidi nyina bibia akontimi kan for Royal Hospital mo bia the nya so kuta insurance so mo nje ohwe oba doctors for no ne nurse for no ti o mani on be sure kama timi kan for Royal Hospital ma awfo bia
me ba ha na menyim ti na me ba ha no me the insurance na ba ni renew ye ba ye no eni gisem ni say oba say insurance ni renew a bibia ye free yenjo he doctors ne midwife omo ha nyina ye good omo siri training pa bibia ehia obi a na say how bia e wo ni padua mu no say onyim te say me amigina ha idea oni problem enti me recommend ahanum Royal Place Hospital am obi a say wa onyim de for any chira hanum no be sure kama ama owo afa ho afa oba asunje
so me kono aduro bi kokwa aduro na me yefu ene be 1 hour na makọ toilet be 7 de na ekoso na no edi nti ade akyen na mka che me kuru se mekọ hospital na o se me kọ hen na me se mekọ bebia ye de se wa baaye no Royal Hospital na me baaye nti me baaye am be hu doctor papa pen mo no na hwe me baaye obisa me ka no kra ne kire no se doctor makọ kokwa aduro bi o na eye me sa makọ toilet be bro de wo ho na wo ma me kọ ye lab nti me baaye no o se e beje me ato ho nti wo kan ya mankasa amane ami hu nti wa na ye je me to ye ma me nsuo 14 akasi no ye ma me 8 enke 26 enti ye hwa me wie ye no me di 3 days wa ha 3 days ni so ye yi me ye se ko me si na doctor be ni na ayi aban doctors kra wo kwa ye jisika ansa na ya hwe na ha ye private hospital na yan jikapre nsuo 14 ya nye me kapre ampa e free ho kwa me ha ye me
Royal Place Hospital is truly making a difference, one patient at a time, proving that healthcare can be both high quality and accessible. At the heart of Kenyase in the Ashanti region, about 20 minutes drive from Royal Place Hospital, lies another exceptional healthcare facility, the Right Care Hospital, a promise and a standard in quality healthcare delivery. Like Royal Place Hospital, Right Care Hospital provides an incredible range of services, all fully covered for NHIS active card holders.
We are a private hospital that engages in services to the public. What makes us unique is that we are fully operating under NHIS policy. We are giving services to the public free of charge without any so-called top-up that other institutions are taking from their clients. We give all sorts of services as a primary hospital. We do general OPD service. We have a specialty eye service. We have obstetric and gynecology. We have a maternity service. We have scan for people who need them. We have lab that do all lab activities here. So a range of activities that we give to the community. We also collaborate with institutions like NHIS that is currently stationed in our place here, registering people on a subsidized basis. What we do is that we are giving these free services to the people in order for them to access health facility, to be able to meet the global SDG goal number 3. That is our focus. The focus is that why should somebody go to hospital or somebody suffer an illness and not be able to access a service because the person is incapable of paying upfront? And that is why we step in to provide NHIS free services to all clients. So everybody that walks in here for any type of our services and hold a membership of an NHIS is getting the services free without any top-up. That is the vision of the CEO of Right Care Health Services, that we are all embracing it and making sure that the community is also getting the benefit out of it. So we are collaborating with NHIS. Since we started with NHIS, there are a lot of people who are coming here registering under the subsidized policy of the facility. Normally, for those that are below 18 years, we register them free of charge without taking any penny from them. Those that are 70 years and above are also getting it free of charge. Those that are in between the 18 and 69, we are taking only 15 cedis. For the services, probably they will get it somewhere around 26 cedis for the same thing. So we are subsidizing for the community so that they will be able to access all their health needs wherever they think they want to access that health needs. But when you come here, all these services that I mentioned, right from the OPD to the general surgeries that we do here, we do them under NHIS policy that is free of charge. You come to the OPD, you go to the consultation free of charge. If there is a need for you to go to lab, you do it free of charge. If there is a need after the lab, the consultation has been done, a doctor asks you to come to the pharmacy for all your drugs, we serve you free of charge without any top-up. So that is what makes us unique in this community.
The insurance bar, you be free from OPD. So we start costing a free. What insurance bar and you be I'm not fancy you champagne for from say free 20 70 years no omodoso enti no tole binsu so a yare ta ba pa pressure and no mama wasi che yare because enam enfie na omadin nti anti de bia so yaya hoboa say hospital no ye benya ye niema bia wo say ye nya ye ndro akade bia wo say ye nya omoba ye say betimi e de ahwe mo oba hanso so a ye mo insurance free no so oba hanso na woni bia ye say insurance so ha e ma free e free mo fra ya wo mo 3 months bo so nyensa ekosi enfie donson no me pa cho ye nji omo hwe do watwe ekosi eduosianan eduosiankron pa cho omo ye ji omo 15 cities ye yisu say hu ama wo mo se de be ye omo so enne say omo ni sikenti omo ntimi mba hospital ye be se bi BFI ye ni suade hu ni say ye so ye be hwe ayarefo ama omo nyankwa se de be ye a Ghana betumpon no say ye wa hode be ye adwuma pi ama ye so ye sika sem asoman no akonenim Right Care has been the hospital that I've been bringing my child. They are good. Due to the health insurance, I don't pay anything unless if they don't have, you go and buy it outside.
Their general OPD and inpatient services deliver seamless care for everyday and extended health needs. Specialized clinics I highlight here, with services like an expert-led ENT clinic, general and specialist surgeries, and holistic antenatal as well as postnatal care. Their pediatric care ensures the little ones are always in safe hands, while obstetrics and gynecological services provide essential support for women's health. Parents can also benefit from the eye clinic, laboratory services, modern scan services, and a well-stocked pharmacy that ensures timely access to medications, all without any out-of-pocket costs to members of the NHIS. Right Care Hospital is a shining example of how accessible healthcare transforms communities, making every patient feel valued and cared for. In a world where quality healthcare remains an elusive dream for many, these 6 extraordinary hospitals shine collectively as an insignia of possibility. They are lifelines, pillars of hope, and havens of healing for countless Ghanaians. Their story is not only about medicine, but about the boundless potential of compassion when paired with vision. What sets them apart is not merely the expertise of their staff or the sophistication of their services. It is their relentless, life-affirming commitment to one transformative mission of providing free healthcare to all active NHIS cardholders. Round the clock, day and night, these hospitals stand up as guardians of free, quality healthcare, ensuring every cry for help is heard, every mother in labor is supported, every child's fever is treated, and no patient is turned away. This is not just healthcare, it is humanity expressed with utmost profundity. It is the embodiment of a community uplifted, lives renewed, and hope restored. These hospitals remind us that when care is accessible to all, the ordinary becomes extraordinary and miracles unfold daily. And as the torchbearer, Mr. Francis Fosu, presses on with his bold campaign to replicate this life-changing model across the nation, the dream of universal healthcare feels closer than ever. These 6 champions of health are not just institutions, they are bridges to a brighter tomorrow, symbols of a nation's resilience, and proof that when compassion lights the way, there are no limits to what can be achieved.